Om de presentatie van de conclusies van de 6 workshops in Hoof.
For the presentation of the conclusions of the 6 working groups, I am now going to give the floor to our colleague Bernard Sabbe, President of the Organizing Committee. Thank you very much, Madam the President, Majesty, Excellencies, ladies and gentlemen. I have the pleasure to introduce the last stage, the closing ceremony. Our aim is to have a reporting back from the 6 working groups along the 6 topics that were included in the opinions of the Royal Academy. Each presenter is going to speak his or her language, so please use your headsets. For the first working group, allow me to invite Professor Danckaerts, defining prevention, intervention, and epidemiology. Thank you very much, Your Majesty, dear youngsters, ladies and gentlemen. Could I have the second slide, please? Unfortunately, we only have 30 minutes for a working group, but the work was really efficient. We tried to focus on 2 issues. First of all, the so-called biopsychosocial model that should be known by everyone is not actually known by everyone. And we were wondering how it could be integrated in the training of people. We realized that more often than not we work in silos and that most care providers do not have a look at on those points. Third point, should we have a universal prevention for mental health and how to reach it, how to get there? Indeed, we see there is a huge increase in mental disorders within youngsters. Also, we see that risk factors are on the increase. And we live in a society that is not really good for our health. To the contrary. Next slide, please. For the first problem, we have raised the following solutions. As it has been put forward in the opinion, each training should focus on the biopsychosocial model. That is not the case at the moment. Hence our proposal. At the very beginning of any training, it should be addressed. It should be presented by people who are convinced of its importance. We would also like every file of every patient would be drafted in the manner in which every 3 aspects would be put forward. Anyone receiving a training in the care sector should be trained to listen, to support, and also to ask the right questions. Everyone at its level. You do not need to be a specialist in every area. Secondly, we think that in each training there should be a meeting with people aware of the different realities. That is, youngsters in our case. Youngsters able to communicate their message, making sure that people being trained understand what is the situation. We can not only train professionals, there are other key contact persons, contact people for youngsters. Sometimes they are able to see signals, but they do not always know what to do with those signals, hence the need for training. This is the case for the second group on the slide, those who work with youth, scouting, sports club, and also for teachers. But I'll come back to it a bit later. Finally, we also said that some professions covered the three aspects and that we should bet on those three aspects. And we think in childcare services and also in doctors working for schools. Secondly, the universal prevention. We were under the feeling that at one given moment in schools, we thought that it was obvious to give some classes to youngsters, but our society is evolving. Why then couldn't we make sure that the school program, the school curricula evolve? Young people also advocated for classes where those aspects could be raised, where it could be possible to talk about all of that. And since maternal school, because it can be put forward in a playful manner. We thought also it was important to act in a decided manner, not to leave everything to chance, to promote dialogue and to make sure that in youngsters' education, time is devoted to that topic, to allow them to talk about it, or at least ask the question, is there a problem? What can we do? We were also thinking about the childcare services and the school doctors. When we talk about universal prevention, of course, schools are universal, but there are other universal areas. We were also thinking about the media. We were wondering whether it could not be timely to show more relevant programs on TV. Young people also told us that those programs were interesting for them. And it was not in a working group, but a psychology professor was telling me why not having a daily program on the importance of mental health. Making sure also that there is a more balanced treatment of information. Why do we accept having only negative news, polarizing news? Why can't we have positive news in the media to give more hope in our society? Then, obviously, on the internet, we need to try and find the right balance in information on mental health and on all the different mental disorders. That was the conclusion of our working group.
Dank u wel, Marina. Dank u wel, professor Danckaerts. Het positieve.
Marina, Professor Danckaerts, thank you very much. Now let's move on to working group 2. This is the positive news of the day: participation and destigmatization. Hello, everyone. Your Majesty, this morning you listened to young people, and participation starts with listening. This is a conclusion, and we need to take time to listen to young people. I think that's what we did today. At least we tried to. Of course, we are not there yet. And I hear young people say that we should have done things differently, and they are right to let us know that it should have been done differently. Micha followed the working group on participation, and she will put forward a few opinions coming from the working group. Micha, you have the floor. Thank you very much. Participation is important, and it should be the case in all areas of young people's lives. It is also a basic behavior that is important. Participation starts with listening to children and youngsters, and a first step is already made when you listen to others. It is important to know whether participation is of quality, if it is enough. We need to assess, and reflection is good, but action is also required. Concrete action. All young people should be involved, not only an elite of young people. All youngsters should be involved in this process. Young people should have the opportunity to take part. For example, they could have a day off, so to say, so that they could attend a workshop on involvement and participation. Then there is also the financial side of all that. It is important to hear the voice of young people, to listen to what they can say. It will require time from them. Maybe they will have cost for that, so they should be compensated. Research needs to be done on participation, and we could talk about it at length for a few days. Maybe we could have a symposium on young people's participation. It could be an added value, who knows?
On a très bien entendu la question.
We heard you really well, a symposium on the youth participation. Workshop 3, registration of data by Professor Dan. Your Majesty, dear colleagues, ladies and gentlemen, dear young people, ladies and gentlemen, we attended to the workshop on registry creation. Allow me, first of all, to convey my deep recognition to Your Majesty for the very nice article that you wrote on mental health of children during the COVID-19 pandemic. It was it was really inspiring, and clearly it inspired me to present those conclusions. There was a consensus on the need to create a registry on the mental health of children and teenagers. Several topics have been addressed. It is, first of all, about empowerment. Maybe Professor Cote or other better other people that have a best French than me will be able to let me know what is the French word for it, but it is the maximal participation. That's what we mean. Maximal participation of the patient, of the family. Creation of a self-support program with or without the monitoring of a care team, sharing different expertise. Everyone emphasized the need of an added value of the registry for the care process, for the patient, for the family, but also for the care process. When it comes to data collection now, we discussed at length to know whether we require to have indicators on mental health. It was presented in a positive manner because it could be concerning each and every one, those indicators, or rather we would focus on pathologies, which could be a basis for action. Everyone agreed to underline the importance of a holistic registration of data, particularly with the care organization in mind. Using structured data when it is necessary and useful, and 2 dimensions, the follow-up of the individual and the population, in order to make sure that mental health evolves. We talked a lot about ethical issues, including the transparency principle for the patient, for the use of data, as we see that there is a scarcity of data currently. The group thought it was nice to have an opt-out system, as is the case in the United Kingdom, for the secondary use of data. also mentioning the importance of anonymization or pseudonymization of data, while stressing the added value for the patient and the family. Taking part in a registry in order to increase the state of play of knowledge and enrich our interventions, primary and secondary interventions, and also insisting on a feedback for the source of information, the individual. The work was really good and efficient, and I thank the organizers for allowing us to do so.
Merci bien, Professor Dhondt.
Thank you very much, Professor Dhondt, for workshop number 4 on the roadmap. I invite Professor Van Hoof, Mr. Holsbeek, Sadad, and Chiara to come and introduce the results. Bridging the gap by roadmap. I think they have a small TikTok interaction with us. Majesty, dear young people, ladies and gentlemen. We were focusing on the roadmap app, and we are convinced that we can use digital technology, the one we all have in our pockets actually, to make progress. We tried to find answers, and I had the sheer pleasure and honor to be able to collaborate with young people. It was inspiring, and I now give the floor to Sana and Chiara. Hello, everyone. We are going to introduce the conclusions of our workshop. We will base our efforts on what is already existing. We are using the digital technology that we already know and that is already available. Well-known structures, well-known apps that are going to be integrated. We need to get rid of thresholds. What are thresholds? Awareness. It's okay not to be okay. It's important to talk about it. It must be done in a cool fashion. We need to use young people's language. It must be understandable for young people. The media used by young people, social media, all of that needs to be integrated in the app. Accessibility as well. Low threshold. We need also to have gathering places. Sometimes it's difficult to find young people, but we can no longer hide behind anything. It could also be online because it helps anonymity, and young people or children who are not ready to talk about it could find a place to talk about it online. Using the language of young people is important. In Belgium, we not only speak English, French, Dutch, or German. There are different cultures, and it is important to take that into account for this app. Anonymity is also important, as well as safety. Young people should feel safe to talk about that and to mention the problems they are having. A big problem is long waiting time. When young people need assistance, they need it now. They cannot wait. Putting them on a waiting list is not a solution. Within our working group, we created a wish list. And a first topic could be what can be done by the young person herself. What can I do to improve my situation? And also maybe discussing with someone, maybe through a very short question list. we see that young people need to talk to someone, and this could lead to an action plan. And young people could integrate what's really helpful for them. And this already exists in an app for the suicide line, where you can talk about your problems. And we would like to launch an appeal. And we would like to elaborate on this idea, but alone we can't do it. Therefore, we were wondering whether there is someone in the audience, or if you know someone who are ready to help us. Please help us. You are an added value. You can always talk to Professor Sabbe if you want to collaborate.
Oké, en dan komen we bij workshop 5, collega Malchair.
We now move to workshop number 5 about perinatal and postnatal care. Your Majesty, dear young people, colleagues, I'd like to thank the workshop participants, and I also would like to thank my colleagues. This is the outcome of a joint work, and I need to thank every participant for their input. Now, the topic is quite broad, hence the need for us to prepare some of our arguments before grasping the work. When parents go through psychosocial vulnerability and difficulties, we do know that many stakeholders are involved on both the children and the parent side. However, there are still many difficulties. We need to tackle the difficulties that are met, the resources that are still lacking when it comes to taking care of perinatal needs. How can we improve the coordination between the various needs and services? So, as an introduction, I would like to say that perinatality must associate various levels. So the prenatal level, the pregnancy stage, then the birth stage, and then the postnatal stage. Psychological assistance is not everything. It is one aspect of the caregiving process. So we need to look at what society can bring, because giving birth is a social action that will involve many stakeholders, close relatives, but also less close relatives. Now, for example, parental leave, assistance at home, and then the experience that is led in Paris with babysitters, nursing home, or external support for the young parents. Now, within our group, we noted that there are already many initiatives that are ongoing, but not all of them are well known and talked about, which means that, yes, there are activities, there are initiatives, but even the professionals are not always aware of such initiatives. Then anticipating is key. Planning ahead, if you want, and using the perinatal approach to anticipate the postnatal approach. And if we focus on the postnatal approach, perhaps we do not act sufficiently on the prevention aspect, which means that we will be having too many problems, while if we act before the birth of the child, at the stage of the pregnancy, well, many problems perhaps can be solved upstream, and we can anticipate the problems that could occur once the baby is born. And this approach can also be carried out with the public bodies that exist in the field of maternity care. Now, of course, the psychological services have also a key role to play, and they are there to give an additional support. Combining medical and psychological support is key. A prenatal consultation is not only about technical examinations, it is also about psychological support. Now, of course, this assistance is dedicated to the most vulnerable people that often lack the access to structures, structures for drug addicts. These are families that you need to give a close follow-up to. And you also need to, well, use the right means, though we know that there are not enough means, not enough funding. So, of course, finding the funding, the right funding is important, but then you need to spend the money properly. So this is another issue that we tackled within our group. So I would say that the key words are networking and inclusion. These were the key words that we agreed on within the group. So combining the dialogue with the adults and with the children, making sure that there is a dialogue between adults and children, which is not always easy to have. Now, of course, having a structure where various stakeholders, adults and children, can speak to one another, can use the structure to improve the cooperation is key. Now, of course, we need to think and we need to heal. So we need to think through before we determine the type of dialogue. And during the dialogue, we need to heal people. Now, of course, we said that in some countries, parental leave was quite long, and perhaps if the parental leave is extended, then we could have less daycare centers, less day nurseries. However, there are some moms who do not want to stop working for an extended period of time. So I think that the offer of daycare center has to meet the needs and of the parents. Now, we talk a lot about structures. Let's not forget that beyond these structures, there are people, there are parents, moms, dads, babies. So the approach needs to be fit to the individual person. Thank you.
Il faudra une petite réflexion philosophique sur penser et penser.
Yes, so thinking and healing, but the word is the same in French, so you can have a pun in French, but not in English. And I will now give the floor to the last two professors who will present the outcomes of their work within their group. Your Majesty, ladies and gentlemen, we would now like to present the findings of our working group. There is at the national level a working group working on transition, and there is indeed a transition chair funded by the King Baudouin Foundation. So we work on and brainstormed on additional ideas. Thank you very much. Now, first of all, I'd like to thank Our Majesty for organizing this symposium. I'm also very grateful to all the adolescents and teenagers who've interacted with our policymakers and with our Queen. I think that the videos, the movies that you've made and where you were shown were very interesting. This is the WHO pyramid. Now, this is a well-known graph that you're all familiar with, but within our working group, we decided to add one item that was missing, the block which is transversal, which is called participation of adolescents, and the inclusion of their context within the dialogue, as well as the inclusion of their parents. We thought that it was important to add this dimension to the diagram. And we think that it is important to build a permanent type of care and dialogue with healthcare professionals and caregivers. So this is the last page of my very own presentation. Now, we have heard the call of young people asking for new opportunities to know what are the right care services that they can call on. There are indeed hotlines that already exist, but they do not match the needs of young people. It is easier for young people to use the internet than to use older devices. So chats can be also easy and user-friendly. Now, there are also other tools that are available online. We do have the feeling that young people with some experience could fulfill a key role in the healthcare sector. So young people with experience. Now, of course, mental care is important, but education, leisure activities are also very important. Now, adult psychiatrists working with us said that when parents face difficulties, they not always think about their children in the way they try to solve their difficulties. Now, assistance and support based on the cultural background. It is important for young people to rely on someone they can trust, not specifically their parents, but someone, just someone they they trust and have confidence in. We ask professionals in charge of education, in charge of young people, to organize meetings to talk about young people and their families. And we also suggest to extend the assistance beyond 23 years old. And though 18 years is the majority age, it is not the age at which assistance should stop. And then this is my last page. This reference point, this contact person should accompany the child or the teenager in the healthcare facilities, in the assistance or leisure facilities, sports facilities, and there should also be assistance given to young people in finding a house, an apartment, and perhaps a platform for parents could also be useful. Today, I also would like to thank Ruud because children psychologists and teenager psychologists should work together to fill the shortcomings that still exist in the way they both interact together. Thank you. Your Majesty, ladies and gentlemen, we are now coming to the end of our session, and we would like to thank Professor Van Winkel for the work he has devoted to young people. For 2 years, they have attended the work of the Commission. They have been supporting young people throughout the past 2 years. So I would like to hand over to my colleagues and to young people specifically for the closing words.
Dag iedereen, ik vond het vandaag een...
Once again, hello. This was a long day. I had to get up very early, and but I'm very happy. I'm very happy, and I am grateful to Our Majesty for attending our session. We learned today that we are being listened to, that we are being looked at, that you communicate with us and you not limit yourself to talking about us. I hope there will be many more days as this one. The ministers have left, but perhaps the members of their department are still attending this session. So please, may I ask you to include us in the debate, in the talk, and to avoid just speaking about us. It is not always easy for someone vulnerable as we are to look at this dialogue from outside. I would like to thank Elke, I'd like to thank Professor Sabbe, and I would like to thank all the other organizers of this symposium. As far as I am concerned, I also would like to thank, first of all, Our Majesty for giving us the floor. Karlien, Sarah, Yvonne, thank you very much for the participation workshop, and thank you for inviting me at that workshop. I learned and I heard that my words are relevant, that my voice is being listened to, and I'm sure that this day will lead to many more. For many days, for many years, I struggled to have my voice heard. I'm very happy that today it has been the case, and thank you for making this symposium a success. We were asked to explain what we have learned today. And I was lucky enough to learn that many things were being done. Many structures already existed, but unfortunately, many of them will have to close because they are not sufficiently funded. We also heard that many initiatives had been talked of and prepared, but they will not be implemented because, again, there are not enough sufficient means. And I heard from policy makers that there are many projects in the pipeline. But I think that we need to rely even more on patients and on healthcare professionals to design these initiatives. Perhaps we do not need more initiatives. Perhaps we do not need more projects. We need more financial means. We need to listen to the patients, and we need to listen to caregivers. We need to enhance the visibility of initiatives that exist. We need to structure the dialogue between policymakers and project leaders. So please rely on us and give us the means to show that we are reliable partners. Thank you.
Majesté, chers invités, chers collègues.
Your Majesty, distinguished guests, colleagues, after these important and moving remarks, it is now time to conclude our symposium. After 2 years of work for which we thank our Majesty, for which we thank the young people. But this symposium is by no means an end. It is only the beginning. And today we are going to put into practice what we have talked about today. We will further develop what has been highlighted throughout the day. And hopefully this work will require another conference about the mental health of children and adolescents, and hopefully policymakers and caregivers will be working together to put into practice all the good ideas that were brainstormed today. Now, just one practicality. After we close the session, Your Majesty will exit the room first, and I will ask you to wait until you are invited to leave the room before doing so. If you allow me, Majesty, I will now close the session.